gives you an idea of things that you can expect when cell division, when the cell cycle goes wrong. So we expect cell division to occur at a normal rate, not get out of control. It's going to be an organized manner. The cells are going to be organized. And so when the cell cycle or when cell division goes out of whack, usually they're increasing the number of cells that we have. These guys aren't the right shape. They're not the right size because of the fact that G1 and G2 part of the cell cycle sometimes isn't given enough time. So interphase doesn't get enough time in order to do what it needs to do. Mitosis ends up kind of duplicating chromosomes over and over again, so you might have a cell that has multiple nuclei in them. Almost all of our cells only have almost all of the cells that have a nucleus only have one nuclei in them. White blood cells are an example of something that has multiple nuclei in it, but they're supposed to. Otherwise, somatic cells are only going to have one nucleus in them. So if they have multiple nuclei, that's an indication that something is going wrong. Size and shape, they should be uniform size and shape. So when you look at a tissue, tissues are the same type of cells working together. So if you look across that tissue, if it doesn't look uniform, if some of the stuff looks out of whack, then there's probably something going on that's not supposed to. For nucleus, I like more that there's multiple nuclei in there rather than they're just talking about small and variably shaped nuclei. If there are specialized features to the cell, we expect them to be a specific way. We expect them to have distinct features. So if those things look wonky, then that might be an indication of what's going on. Arrangement, each tissue is going to have a specific arrangement to those cells. And so like the very first picture, if we've got a whole bunch of cells multiplying rapidly, they don't have that density dependence that's going to stop that division, so they're just going to stack on top of each other when they shouldn't. So when we do the EOC, of course they're updating the EOC, and they have over the past year or so, so I'm not 100% sure. But I would expect that it would be something more along the lines of this that they're asking you to diagnose rather than something along the lines of the microscopic images. If you're a histologist and you do that all the time, you can look at that and pick that stuff out really quickly because you know what you're looking for, you know where it's supposed to be, you know how it's supposed to look. We are looking at microscopic images like once and then moving on. So I really don't expect you to be experts. However, the caveat would be is maybe they give that stuff to you and expect you to make a diagnosis, not based on the pictures themselves necessarily, but maybe based on any additional information that they give you. So they might give you a microscopic image, but then have a narrative that goes along with it that you need to read and pick out the clues from the narrative, from the writing part that goes with it, rather than just the picture. Does that make sense? All right, so let's label these pictures. First things first. The top image I have at a magnification of 40x. The bottom image I have at a magnification of 80x. That would be something that I would expect that they would want you to notice is that the magnification of the images that you're looking at. Are you looking at the images and comparing them at the same magnification? If not, that's going to make a difference. Do you remember how to determine magnification of a microscopic image? There's a slightly more technical term. Ocular. Okay, so the eyepiece is an ocular. Those two terms mean the same thing. So the lenses that are hanging from the nose piece, those are called objectives. So it's the eyepiece, it's the ocular times the objectives. And I like the fact that you got your notebook out and went to it and even knew where it was at. I'm very impressed with that today. So this magnification would have been the eyepiece times the objective, whatever they were using to get that magnification. So When we're looking at this, we're looking at it in 3 different layers. So this right here is my first layer. Here's my second layer. Here's my third layer. So go ahead and mark your picture, and then I'll give you information about what each one of those layers represent. And this picture at the top is actually supposed to be representing a normal skin sample, healthy skin sample. So 221 has been talking about basal cell carcinoma. Carcinoma indicates a cancer. Layer 1 right here represents the epidermis. The epidermis is a protective layer of your skin. The epidermis is actually made up of some dead skin cells, and you can kind of see that layer of dead skin cells all the way on the top right there. The basal layer is at the bottom of the epidermis, and that's the area that's undergoing mitosis. That's where cell division is occurring. We don't have cell division occurring anywhere else because these other cells, they're either dead or they're dying. You know, they're not cells that are going to reproduce. So the basal cells are the ones right here, and they're creating new cells, and then they push up the old cells, and as the old cells push up, then they get sloughed off the top. Right? So this was our epidermis. This layer right here is the dermis layer, and it's got blood vessels and nerves. And so this is a healthy skin sample, but these dips in it are probably where a hair follicle was at, because this looks like maybe a hair follicle and maybe a sebaceous gland, an oil gland, and a sweat gland, something along those lines. So this would represent a biopsy at any rate. So when you do biopsies, they can do it in a lot of different ways, but one of the most common ones that people have heard about is the needle biopsy. And so they're going to take a needle and just poke it in right in whatever spot that they're trying to biopsy. And then that's what they put on the microscope slide in order to analyze. So this would be a biopsy of the skin. This third layer is our subcutaneous layer. Does anybody know what these little cells are? You can see the little circles, but they look like they're empty. No, this is skin. So red blood cells would be in a blood vessel. It won't be out through here. This is a tissue type. It is a connective tissue. Do we know specifically what type of connective tissue it might be? Nervous tissue is a different type. So I've got these little cells that look like they're empty, but they're not empty. They're storing materials, and these materials can help to insulate and protect what's underneath it. Yes. Which type of connective tissue would it be? It's helping to insulate and protect. No. Cartilage would be associated with a bone rather than with skin. It is adipose tissue. What is adipose tissue? What is that? That's fat. So all of these little circles here, they're storing that fat. That's why they look like they're empty, because they're so full of fat. But that's a good thing because it's insulating those layers right there. The third one's called the subcutaneous layer. Okay, so the first layer is the epidermis. It's the outermost protective layer. The basal cells in reference to the basal cell carcinoma in 221, the basal cells are at the bottom of the epidermis. Dermis is that middle layer. It's got blood vessels, nerves, sweat glands. The third layer is the subcutaneous layer. Fat, connective tissue. Epidermis is the outermost protective layer. Basal cells are at the bottom of the epidermis. Next layer is the dermis. Hair follicles, nerve endings, blood vessels, sweat glands, oil glands. That's where those things can be found. And then subcutaneous level is the connective tissue level. It's got a lot of adipose tissue. Bless you. So the top picture, the smaller picture, is supposed to be representative of a healthy biopsy, healthy skin sample. So the second picture is actually showing us a microscopic sample of skin with basal cell carcinoma. So once again, this would be a biopsy, and the biopsy would be in the location where the bump was at. So you're not just like randomly poking people with the needle. You're doing the biopsies where you see the disease, where you see the dysfunctioning skin cells at. And so there's going to be this bump that just doesn't heal. What's the deal with it? So they're going to take a biopsy of that. And so remember that this next one is 80 times, whereas the first one was a 40 times magnification. So the next picture that we see, that we're basically looking pretty much at the epidermis right here, and maybe just to the top part of the dermis. We're not looking at all three layers. So the second image is just showing us a cross section that might be something that's going to be right in this area. We can tell that because these look like those dead skin cells that are on the top that we can just barely see on this one. And we can kind of see this layer that's this darker layer right here. So basal cells are the ones that are at the bottom of the epidermis. And in this area right here, we don't see it the uniform pink all the way down. We see that there's some stuff that's kind of invasive in here that doesn't look like it's supposed to be there. They're also saying that these little cells right here, this represents nests or places where there are cancer cells that are growing within that bottom part of the epidermis, the top part of the dermis. But this would be our basal cell carcinoma part because that's where those basal cells are growing rapidly and out of control. So, basal cell carcinoma, we've got patches of rapidly growing cells in the basal layer of the skin. So basal cell carcinoma, got patches of rapidly growing cells in that basal layer of the skin. So eventually 221 is supposed to take you to a picture of Kai's biopsy, which is the image that I just put on your table. And the idea is you're supposed to look at that and determine if Kai's growths are malignant or benign. So if you were a histologist and you see this stuff and you're trained, then you would have no problem with it. But once again, you know, us doing it one time, and even me looking at that, I'm like, okay, whatever you say. So when I look at these cells, we know that Kai's isn't basal cell carcinoma because of the way he's presenting, because of the symptoms that he has. We do know that he has some suspicious growths because he's got these bumps that are on his skin that aren't supposed to be on his skin. So this would be one of those little biopsies where they took it and they would have taken it right from that bump in order to take a look at that. So this isn't like a big, long cross-section of skin. This is just right there, a little needle biopsy wherever that bump was at. So when I look at this, I mean, it looks disoriented and it looks like a jumbled mess to me. So I rely on the histologist who says the biopsy tumor shows that the cells are consistent in size and shape. Whatever you say, dude. They have single regularly shaped nuclei. We can't really see it from this picture, I don't think, so I'm going to go with what they're saying. And appear to be well organized. Okay, so I'm going to go with what they're saying. So the thing is that he still has tumors. He has a tumor because he has these bumps. But the tumors are not malignant. That means that they're benign. So this isn't cancer, but he does have tumors. He does have benign growths.